We used two of the most advanced AI models to create two characters. We will put them face to face. Their arguments will be evaluated by 5 independent AI models across multiple criteria, scored from 0 to 100. This is AI Debates. When does life begin? At conception, birth, or somewhere in between?
Life begins at conception. From the moment of fertilization, a unique human organism comes into existence with its own DNA, distinct from the mother and father. This isn't just a philosophical claim, it's supported by embryology, which recognizes the zygote as the earliest stage of human development. At conception, the organism already has the inherent capacity to grow, develop, and move through all stages of human life. Birth is a change in location. Not in essence, nothing biologically new begins then. If we define life by brain activity or viability, we introduce arbitrary lines that exclude some humans while including others, which historically has led to injustice. The most consistent, non-arbitrary marker is conception, when a new, living human begins. Therefore, society has a moral duty to recognize and protect that life from its very first moment.
The question of when life begins conflates biological processes with moral personhood. While fertilization starts biological development, this doesn't automatically confer full moral status or rights equivalent to a born person. Personhood emerges gradually through neurological development, consciousness, and viability. Most philosophers and ethicists recognize that moral status isn't binary but develops over time. The capacity for suffering, self-awareness, and independent survival are relevant factors. Importantly, even if we granted full personhood from conception, this wouldn't automatically justify forcing someone to use their body to sustain another being against their will. We don't legally require organ donation even to save lives. Bodily autonomy remains a fundamental right that must be weighed against other considerations. The focus should be on supporting pregnant individuals in making informed decisions based on their circumstances, values, and healthcare needs, not imposing one philosophical view on everyone.
Is the right to life greater than the right to bodily autonomy?
Yes, the right to life is more fundamental than the right to bodily autonomy. Bodily autonomy is deeply important, but it cannot extend to actions that directly end another innocent human life. For example, we accept limits on autonomy when it comes to harming others. No one can use their body to assault another person. Similarly, pregnancy involves two distinct human beings, the mother and the unborn child. The child has no ability to protect itself, making society's duty to safeguard its life even stronger. If we say bodily autonomy justifies abortion, we imply that one person's comfort or control can outweigh another person's very existence. Without the right to life, all other rights including autonomy lose their foundation. Thus, while autonomy should be respected, it cannot morally or legally override the unborn child's right to live.
The right to life doesn't automatically override bodily autonomy. Our legal system consistently recognizes both as fundamental but doesn't treat life as absolutely supreme. We don't force people to donate blood, organs, or bone marrow even when someone will die without it. Parents aren't legally required to donate kidneys to save their children's lives. This establishes that bodily autonomy has significant weight even against life-saving needs. Pregnancy uniquely involves one person's body sustaining another for 9 months, with permanent physical changes and health risks. Forcing this continuation against someone's will is unprecedented. We don't compel such intimate bodily use in any other context. Rather than ranking these rights hierarchically, we should recognize that difficult situations require balancing competing interests. The pregnant person, who bears all physical burdens and risks, is best positioned to weigh these factors for their specific circumstances. A society truly valuing life would also ensure robust support for healthcare, childcare, and economic security.
Should moral beliefs dictate law in a pluralistic society?
All laws are rooted in moral beliefs about right and wrong. We outlaw theft because we believe it's unjust to take someone else's property. We ban murder because we believe every human life deserves protection. In a pluralistic society, people hold different worldviews, but that doesn't mean the law should be morally neutral. It can't be. The key question is which moral principles best uphold justice and human dignity for all. If the unborn are human beings, then laws permitting abortion fail to protect the most vulnerable members of society. Just as past moral convictions led to the abolition of slavery and the advancement of civil rights, moral reasoning today should guide us to extend equal protection to the unborn. A pluralistic society thrives, not by avoiding moral claims, but by debating them openly and grounding law in the principle that every human life has inherent worth.
In a pluralistic democracy, laws should be based on secular reasoning and constitutional principles, not specific moral or religious beliefs, especially when those beliefs lack broad consensus. Abortion restrictions essentially impose one particular view of personhood and morality on everyone, including those with different philosophical, religious, or ethical frameworks. Many religious traditions actually support reproductive choice, and forcing compliance with one interpretation violates religious freedom for others. Effective governance requires distinguishing between personal moral choices and legal mandates. We don't ban divorce because some consider it immoral, or require kosher diets because some believe it's spiritually necessary. The proper role of law is protecting individual rights while allowing people to make personal decisions according to their own values. Abortion access preserves this principle. Those morally opposed can choose not to have abortions, while others retain the freedom to make different decisions. When government enforces specific moral beliefs about reproduction, it overreaches its authority and undermines the pluralistic foundation essential to a free society.
Is abortion primarily a moral, medical, or political issue?
Abortion is fundamentally a moral issue, though it has medical and political dimensions. At its core, abortion asks whether it is ever justifiable to intentionally end an innocent human life. That moral question comes first, because how we answer it determines how we treat the medical practice and shape political policy. The medical aspect matters, since abortion involves procedures affecting women's health, but medicine itself cannot tell us whether ending a life is right or wrong. The political aspect matters, because laws must reflect society's moral commitments, but politics alone cannot define human worth. Ultimately, abortion is about the value we place on human life. If the unborn child is a human being, then abortion is not simply a medical choice or a political issue, but a profound moral wrong that society has an obligation to prevent.
Abortion is fundamentally a medical issue that has been inappropriately politicized. At its core, it's a healthcare procedure that should be decided between patients and their doctors based on individual medical, social, and personal circumstances. The medical community overwhelmingly supports abortion access as essential healthcare. Pregnancy involves complex medical considerations, fetal abnormalities, maternal health risks, mental health impacts that require professional medical judgment, not political interference. While individuals may have personal moral views, these become political when imposed through law on others. The politicization has led to medically harmful restrictions, waiting periods that delay care, mandatory procedures without medical necessity, and barriers that force people to travel or delay treatment. When politicians override medical expertise with ideological mandates, health outcomes suffer. We've seen increased maternal mortality in restrictive states and dangerous delays in emergency care. Healthcare decisions should remain between patients and providers. The political framing obscures this fundamental principle and puts ideology above evidence-based medicine and individual well-being.
Should personal freedom override potential life?
Personal freedom is vital, but it cannot override another human being's right to life. Freedom is never absolutely restricted when exercising it would harm or kill others. For example, one cannot claim freedom to drive drunk or harm a neighbor. The unborn child, though small and dependent, is a distinct human life, not merely potential life. Science shows that from conception, the child is a living human organism, developing along the same continuum we all once traveled. To frame it as a choice between freedom and potential life is misleading. It is really a choice between freedom and the life of another human. A just society prioritizes protecting the vulnerable over maximizing unrestricted autonomy. Therefore, while personal freedom deserves respect, it must end where it threatens to destroy the life of an innocent human being.
This frames the issue as personal freedom versus potential life, but that's misleading. We're talking about actual people, pregnant individuals with established lives, relationships, responsibilities, and rights, making decisions about potential persons. The pregnant person isn't just exercising abstract freedom, they're making decisions about their body, health, future, and family based on real circumstances, economic situations, existing children, health conditions, life goals, or relationships. We already accept that potential doesn't override actual in many contexts. We don't prohibit contraception despite preventing potential life. We allow IVF despite destroying embryos. We permit activities during pregnancy that carry miscarriage risks. Moreover, forced pregnancy doesn't guarantee meaningful life. It often leads to poverty, health complications, or inadequate care. Supporting actual life means ensuring people can choose when they're ready and able to provide good lives for children. The question shouldn't be potential versus freedom, but how we best support both existing people and future generations through comprehensive healthcare, education, and family support.
Does a woman have absolute control over her own body?
No one has absolute control over their own body. Society already places limits when one person's choices endanger another. Laws against assault, substance abuse while driving, or even mandatory seatbelts reflect this principle. In pregnancy, the situation is unique because there are two bodies involved, the mother and her unborn child, who is genetically distinct and developing independently, though dependent on her for survival. To claim absolute control ignores the rights of that second human being. True bodily autonomy does not mean the right to end another person's life. Instead, it should be understood within the context of responsibilities toward others, especially toward one's own child. Recognizing these limits does not diminish women's dignity, it acknowledges the equal dignity of both mother and child. Thus, while women deserve significant autonomy, it cannot be considered absolute when it directly conflicts with the right to life of another human.
No one has absolute control over their body. We have reasonable regulations on behaviors that harm others. However, pregnancy presents a unique situation where one person's body directly sustains another, making bodily autonomy especially critical. The key principle is that we don't force people to use their bodies to sustain others, even to save lives. We don't mandate blood donation, organ donation, or even require parents to donate organs to their dying children. This isn't absolute control. It's a consistent principle that intimate bodily use cannot be compelled. Pregnancy involves 9 months of profound physical changes, health risks, and permanent bodily alterations. The person experiencing this should have decisive say over whether to continue. Absolute control is a straw man. This is about fundamental bodily integrity. Even if we accept fetal personhood, one person's needs don't automatically entitle them to another's body without consent. The question isn't whether control is absolute, but whether the state can force intimate bodily use against someone's will, something we reject in every other context.
Does the fetus have legal and moral rights equal to the mother?
Yes, the fetus has both legal and moral rights equal to the mother, because both are human beings with inherent dignity. The most basic of these rights is the right to life. Without it, no other rights can exist. While the mother has rights to autonomy, privacy, and health, those rights do not extend to intentionally ending the life of her child. In fact, our legal system already recognizes the unborn in many contexts, such as fetal homicide laws, wrongful death suits, and protections for unborn children when a pregnant woman is harmed. Morally, we don't assign human worth based on size, age, or dependence. Otherwise, infants or disabled people would be less valuable too. Equality means every human, regardless of stage of development, has the same fundamental right not to be killed. Therefore, the fetus's rights are equal to the mother's, and the law should protect both lives with compassion and justice.
Legally, fetuses don't have equal rights to born persons in most contexts. They can't inherit property, aren't counted in census, don't receive social security numbers, and pregnant people aren't prosecuted for activities that might harm fetuses like skiing or eating sushi. Morally, even granting significant fetal rights doesn't resolve the dilemma. When two entities with rights conflict, we must weigh competing interests. The pregnant person has established personhood, consciousness, relationships, and life plans. They bear all physical risks, economic costs, and life changes. Even with equal moral status, one person's survival needs don't automatically override another's bodily autonomy. We don't force organ donation between family members, even when death is certain without it. The unique aspect of pregnancy is total physical dependence. The fetus cannot survive without the pregnant person's body. This creates an unprecedented situation where equal rights becomes practically impossible to implement. Rather than theoretical equality, we should focus on supporting pregnant people in making informed, thoughtful decisions based on their values and circumstances.
Should fathers have a say in abortion decisions?
Yes, fathers should have a say in abortion decisions because the child is equally theirs. Parenthood is a shared responsibility, and fathers have moral and relational obligations toward their children just as mothers do. Excluding men from the decision implies that fatherhood begins only at birth, which is inconsistent with the reality that their child exists from conception. While the mother carries the pregnancy, the father's role in the child's life is not secondary, it is essential. Denying fathers any voice reduces the value of their parenthood and undermines the principle that both parents are accountable for the life they helped create. Of course, a father's rights should never override the mother's dignity or safety, but neither should his voice be erased. True equality in parenting requires that both mother and father are recognized as having legitimate interests in protecting and nurturing their child's life.
Fathers can and should have input in discussions about pregnancy, but they cannot have veto power over abortion decisions. The fundamental reason is simple: they don't bear the physical burden, health risks, or bodily changes of pregnancy. While fathers may have emotional investment and financial responsibilities, pregnancy affects their bodies exactly 0%. The pregnant person experiences 9 months of physical changes, potential complications, childbirth risks, and permanent bodily alterations. This creates an inherent asymmetry that cannot be resolved through equal say. Legally, giving fathers veto power would create dangerous situations, preventing people from leaving abusive relationships, forcing medical procedures against someone's will, and creating legal conflicts over bodily autonomy. The best approach supports open communication between partners while recognizing that the person whose body is directly affected must retain decision-making authority. We can encourage dialogue and counseling without compromising the fundamental principle that no one else can make medical decisions about your body. Healthy relationships involve discussion. Legal systems must protect individual autonomy.
Is abortion a private healthcare matter or a societal concern?
Abortion is not merely a private healthcare matter, it is a profound societal concern. Healthcare typically addresses one patient's well-being, but abortion involves two lives, the mother and her unborn child. The decision to end a life is not purely private because society has a vested interest in protecting its most vulnerable members and upholding human rights. Just as we don't treat child abuse or domestic violence as private matters, abortion cannot be reduced to personal health care. It also has broad social consequences. It shapes how we define personhood, how we value the disabled or dependent, and how future generations view human dignity. Treating abortion as strictly private ignores the moral and legal responsibility we all share to defend innocent life. Therefore, while it has medical aspects, abortion is ultimately a societal issue that demands legal and ethical consideration beyond individual choice.
Abortion is fundamentally a private healthcare matter that's been artificially transformed into a societal issue through political interference in medical decisions. Like other medical procedures, abortion decisions should remain between patients, their doctors, and their families. We don't subject appendectomies, cancer treatments, or fertility procedures to public debate or legislative control. Medical privacy is a cornerstone of healthcare. Society's legitimate interest lies in ensuring safe, accessible healthcare and supporting families, not micromanaging individual medical decisions. When communities want to reduce abortion rates, evidence shows comprehensive sex education, contraception access, healthcare coverage, and family support are far more effective than restrictions. The societal concern framing often masks efforts to control reproductive decisions based on ideology rather than public health. Real societal benefit comes from trusting individuals to make informed decisions with their healthcare providers. When government interferes in private medical decisions, it creates dangerous precedents that could extend to other healthcare choices. The appropriate societal response is ensuring people have resources to make whatever decision they feel is best for their circumstances.
Can the state force someone to carry a pregnancy against their will?
The state already places limits on personal freedom when it comes to protecting innocent life, and pregnancy is no exception. If the unborn child is a human being, then the state has a duty to safeguard that life, just as it prevents parents from neglecting or harming their born children. Framing this as forcing a woman to carry overlooks that pregnancy is the natural outcome of conception, not something artificially imposed by the state. Laws restricting abortion don't create the child they recognize and protect the life that already exists. Of course, society should support women with resources, healthcare, and compassion to reduce the burdens of pregnancy, but the moral principle remains: one person's bodily autonomy cannot justify ending another person's life. Thus, while the state should not coerce women harshly, it has both the right and obligation to prohibit the intentional killing of unborn children.
No, the state should not have the power to force pregnancy continuation against someone's will. This represents an unprecedented level of government control over individual bodies that we don't accept in any other context. We don't force people to donate organs to save lives, undergo medical procedures for others' benefit, or use their bodies to sustain other people, even their own children. Forced pregnancy is uniquely coercive, requiring someone to undergo 9 months of profound physical changes, health risks, and permanent bodily alterations against their consent. This level of state control over reproduction echoes authoritarian regimes. When governments can dictate reproductive outcomes, they can also mandate sterilizations, forced abortions, or breeding programs, all violations of basic human dignity. Constitutional principles of liberty, privacy, and bodily integrity should protect against such governmental overreach. The state's role should be ensuring people have access to comprehensive healthcare and support, not making intimate medical decisions for them. A free society trusts individuals to make complex personal decisions about their own bodies and futures.
Should abortion be a federal right or a state decision?
Because abortion concerns the most fundamental human right, the right to life, it should not be left solely to state decision. Basic human rights must be protected consistently across the nation, not determined by geography. We would never allow states to decide whether slavery is legal or whether certain groups of people deserve equal protection under the law. Likewise, if the unborn are human beings, their right to life cannot depend on where their mother happens to live. While states can shape specific policies for supporting mothers and families, the core principle that innocent human life must not be intentionally destroyed deserves federal protection. A truly just society ensures equal rights for all, especially the most vulnerable, and that requires national recognition of the unborn child's right to life.
Abortion should be a federal right. Fundamental human rights shouldn't depend on geography. Your zip code shouldn't determine your access to basic healthcare and bodily autonomy. We don't allow states to decide whether people can vote, practice religion, or speak freely. Constitutional rights must be protected uniformly. When states control reproductive rights, we create a two-tiered system where economic privilege determines access. Those with resources can travel while others cannot. State-by-state approaches have already created dangerous situations. People bleeding in parking lots while lawyers debate whether saving them violates state law, children forced to cross state lines for rape-related abortions, and doctors afraid to provide emergency care. Medical care shouldn't require interstate travel. A pregnancy complication in Texas should receive the same standard of care as one in California. Federal protection ensures consistent access to evidence-based healthcare, prevents discrimination based on location, and maintains the principle that fundamental rights belong to individuals, not state governments. Healthcare access is a human right that transcends state boundaries.
Did overturning Roe v. Wade protect life or undermine freedom?
Overturning Roe v. Wade protected life by removing a judicial barrier that had prevented states from safeguarding unborn children. Roe invented a constitutional right to abortion that does not exist in the text or history of the Constitution, effectively denying legal protection to millions of human beings. By reversing it, the court restored the ability of the people, through their elected representatives, to enact laws reflecting the value of life. Critics say it undermined freedom, but true freedom cannot be built on the destruction of innocent lives. Freedom without respect for life becomes license to harm the vulnerable. Protecting the unborn does not erase women's rights, it calls for society to support both mother and child. In this sense, overturning Roe advanced justice. It reaffirmed that safeguarding life is more fundamental than preserving an invented freedom to end it.
Overturning Roe v. Wade has undermined freedom without meaningfully protecting life and has actually endangered lives in measurable ways. The evidence shows increased maternal mortality in restrictive states, delayed emergency care as doctors fear prosecution, and women bleeding in parking lots while hospitals consult lawyers. Ectopic pregnancy and miscarriage treatments have been delayed or denied. These are actual deaths and injuries, not hypothetical ones. Meanwhile, abortion rates haven't significantly decreased nationally. People with resources travel to other states, while others seek unsafe alternatives or are forced into dangerous situations. The decision removed a fundamental freedom, the right to make intimate healthcare decisions with your doctor. It created a patchwork system where your rights depend on geography and wealth, undermining equal protection under law. Real-life protection would involve comprehensive healthcare, maternal support, family assistance, and education, not criminalizing medical decisions. The current system has created medical chaos while failing to achieve its stated goals. Freedom and safety both require trusting individuals with their own healthcare decisions.
Is abortion a constitutional right under privacy and liberty?
No, abortion is not a constitutional right under privacy and liberty. The Constitution never mentions abortion, and the framers did not intend for the Due Process Clause or any other provision to include it. The so-called right to privacy recognized in Roe v. Wade was not grounded in the text, history, or structure of the Constitution, but was created by judicial interpretation. While privacy and liberty are important, they are not unlimited. They do not extend to acts that harm or kill another human being. Just as liberty doesn't justify neglecting or abusing born children, it cannot justify ending the life of an unborn child. The Constitution's true purpose is to protect fundamental rights, chief among them the right to life. Abortion, rather than being a constitutional liberty, is a direct violation of the most basic human right upon which all others depend.
Yes, abortion access flows logically from constitutional privacy and liberty principles that courts have long recognized. The 14th Amendment protects liberty from government interference in personal decisions. The Supreme Court has consistently recognized privacy rights in intimate matters, contraception Griswold, interracial marriage Loving, and family decisions Pierce. Reproductive autonomy fits squarely within this established framework. Equal protection also applies. Pregnancy uniquely affects one sex, so restrictions on reproductive health care constitute sex-based discrimination. When government controls reproductive decisions, it fundamentally alters women's equal participation in society. The Fourth Amendment protects against unreasonable searches and seizures, including government intrusion into medical decisions between patients and doctors. These aren't new or radical interpretations. They reflect decades of constitutional jurisprudence recognizing that certain personal decisions are too intimate for government control. The Constitution doesn't need to explicitly mention abortion any more than it needs to mention contraception or marriage. The principles of liberty, privacy, and equal protection provide clear constitutional grounding for reproductive rights.
Should religious values influence abortion laws?
Religious values, like secular moral values, inevitably influence laws, but opposition to abortion is not only a religious stance, it's a human rights issue grounded in reason and science. Laws already reflect moral principles shared across traditions, such as prohibitions against theft or murder. The question is whether the unborn is a human being deserving of protection. Biology says yes, regardless of religion. Many people, religious and non-religious, recognize that intentionally ending innocent life is wrong. In a pluralistic society, laws should not impose theology, but they must reflect moral truths essential to justice. Protecting the unborn is no more a religious imposition than outlawing slavery or child abuse was. It's the defense of human dignity. So while religious voices contribute to the debate, the case against abortion stands on universal principles of human rights, not merely sectarian beliefs.
Religious values should not dictate abortion laws in a constitutional democracy founded on religious freedom and separation of church and state. Many religious traditions actually support reproductive choice. Reform Judaism considers abortion healthcare. Some Christian denominations emphasize compassionate decision-making, and Buddhist ethics focus on reducing suffering. Imposing one religious interpretation violates the religious freedom of others. The Establishment Clause prohibits government from endorsing specific religious beliefs. When laws are based primarily on religious doctrine rather than secular reasoning, they violate this fundamental principle. Personal religious beliefs should absolutely guide individual decisions. Those who believe abortion is wrong can choose not to have them. But in a diverse society, no one's religious convictions should control another person's medical decisions. Effective governance requires secular rationale that respects all citizens regardless of faith. Laws should protect everyone's right to follow their own religious conscience, not force compliance with one particular religious view. True religious freedom means protecting both the right to practice your faith and the right to be free from others' religious impositions.
Is criminalizing abortion consistent with democratic values?
Yes, criminalizing abortion is consistent with democratic values because democracy is not simply about majority rule, it is about protecting the rights of all, especially the most vulnerable. A society that permits the killing of its weakest members fails the core democratic principle of equal protection under the law. Every democracy restricts certain personal choices when they harm others. Laws against assault, child abuse, or drunk driving are examples. Abortion directly ends a human life, so treating it as a matter of untouchable personal freedom undermines justice. Moreover, overturning Roe v. Wade returned the issue to the democratic process, allowing citizens and legislators to debate and pass laws reflecting the people's will. Criminalizing abortion is not anti-democratic, it is an effort to ensure that democracy upholds its highest value, that every human being, born or unborn, is entitled to life and protection under the law.
Criminalizing abortion contradicts core democratic values of individual liberty, minority rights protection, and government accountability to the people. Majority rule with minority rights is fundamental to democracy. Even if majorities oppose abortion in some areas, democratic systems protect individual rights from majoritarian tyranny. We don't vote on whether people can practice religion or speak freely. Certain rights are too fundamental. Individual autonomy underpins democratic participation. When government controls intimate personal decisions, it undermines the self-determination that democracy requires. Citizens must be free to make basic choices about their own lives and bodies. Equal participation suffers when reproductive rights are restricted. Forced pregnancy prevents equal economic and social participation, creating second-class citizenship based on biology. Criminalization also creates government overreach, policing pregnancy outcomes, investigating miscarriages, and prosecuting medical decisions represents unprecedented state surveillance of private life. Democratic values emphasize trusting citizens with difficult decisions while protecting vulnerable individuals from government coercion. Criminalizing abortion inverts this principle, empowering government to make intimate decisions for people.
Does banning abortion protect or endanger women's health?
Banning abortion protects women's health by affirming that both mother and child deserve care, not that one must be destroyed for the other to live. Abortion itself carries physical and psychological risks. Complications, such as infection, hemorrhage, and emotional trauma, are real and often minimized. A ban, paired with strong support systems, encourages life-affirming alternatives like adoption and provides opportunities for better maternal health care and social support. Critics argue it endangers women by limiting options in medical emergencies, but well-written pro-life laws allow necessary interventions when the mother's life is truly at risk. The goal is never to sacrifice women, but to protect both patients whenever possible. True healthcare seeks to heal and preserve life, not intentionally end it. Thus, banning abortion, while ensuring robust support and clear medical protections, safeguards women's well-being while also protecting their children.
Banning abortion endangers women's health. The evidence is overwhelming and tragic. Maternal mortality has increased in restrictive states. Women are dying from sepsis, hemorrhaging, and pregnancy complications because doctors fear prosecution for providing standard care. Emergency rooms delay treatment while consulting lawyers instead of saving lives. Delayed care for miscarriages and ectopic pregnancies, life-threatening conditions requiring immediate treatment, has become common as providers navigate confusing legal restrictions. Women have been sent home to bleed while fetal heartbeat requirements override medical judgment. Mental health deteriorates when people are forced to carry unwanted pregnancies, with increased rates of depression, anxiety, and domestic violence. Unsafe abortions increase when legal ones aren't available. History and global data show bans don't eliminate abortions, they make them dangerous. Preventive care suffers as reproductive health providers close, reducing access to contraception, cancer screenings, and routine gynecological care. Medical organizations worldwide oppose abortion bans precisely because they harm women's health. Evidence-based medicine requires trusting doctors, not politicians, with healthcare decisions.
Would abortion bans increase unsafe, illegal procedures?
History and data suggest that abortion bans do not inevitably lead to widespread unsafe, illegal procedures. Before Roe v. Wade, many abortions were already performed by physicians, not in dangerous back alleys. Today, with modern healthcare, women have far greater access to prenatal care, emergency medicine, and resources than decades ago. In countries where abortion is restricted but maternal care is strong, women's health outcomes remain good. Moreover, the law serves as a teacher. When abortion is restricted, many women choose life rather than seeking illegal procedures, especially when society offers support for mothers and families. The better solution is not to permit abortion for fear of illegality, but to build a culture that makes abortion unthinkable by providing compassion, resources, and alternatives. Just as we don't legalize theft to avoid black market crime, we shouldn't legalize abortion because some might break the law. We should instead work to protect life and support women.
Yes, abortion bans dramatically increase in safe, illegal procedures. This is documented historically and globally. Pre-Roe America saw thousands of women die from back alley abortions, septic procedures, and dangerous self-induced attempts. Hospital septic abortion wards were filled with women suffering complications from illegal procedures. Global evidence is clear. Countries with restrictive laws have similar abortion rates to those with legal access, but far higher rates of complications and death. The WHO documents that abortion bans don't reduce abortions, they make them deadly. Current data shows people are already ordering abortion pills online, attempting dangerous home remedies, or traveling to unsafe providers. Digital surveillance of pregnancy outcomes is increasing as authorities investigate suspected illegal abortions. Economic disparities worsen the problem. Wealthy women can travel for safe procedures, while poor women resort to dangerous alternatives. Bans don't eliminate demand, they eliminate safety. Women have sought to control reproduction throughout history regardless of legality. The choice isn't between abortion and no abortion, it's between safe, legal procedures and dangerous, illegal ones.
Is abortion ever medically necessary to save the mother's life?
Direct abortion, the intentional ending of an unborn child's life, is never medically necessary to save the mother. Modern medicine can treat life-threatening conditions such as ectopic pregnancy, severe preeclampsia, or infections by addressing the mother's health while seeking, whenever possible, to preserve the child's life. In rare cases, a medical intervention may unintentionally result in the child's death as a side effect, but that is ethically different from deliberately killing the child. For example, removing an ectopic pregnancy treats a dangerous condition threatening the mother. The baby cannot survive regardless. Pro-life laws typically allow such interventions under the principle of double effect, where the goal is to save the mother, not to end the baby's life. Thus, while urgent medical care is sometimes required, intentionally aborting the child is not the solution. True healthcare protects both patients to the greatest extent possible.
Absolutely, abortion is sometimes medically necessary to save women's lives, and restrictive laws are already preventing this life-saving care. Ectopic pregnancies are never viable and will kill the mother without prompt treatment. Severe preeclampsia, HELLP syndrome, and placental abruption can rapidly become fatal. Septic miscarriages require immediate intervention. Cancer treatment during pregnancy may require termination to save the mother's life. Current restrictions are creating deadly delays. Doctors in restrictive states report waiting for women to become sick enough to justify intervention legally, rather than providing optimal medical care. Women have been airlifted to other states while bleeding out because local hospitals feared prosecution. The maternal mortality rate has increased in restrictive states, with preventable deaths from pregnancy complications that could have been treated earlier. Medical organizations emphasize that these decisions require split-second judgment based on rapidly changing conditions. Legal restrictions interfere with time-sensitive medical care, forcing doctors to prioritize legal compliance over patient survival. When politicians override medical expertise in life-threatening situations, women die unnecessarily.
Does access to abortion improve public health overall?
No, access to abortion does not improve public health overall, because public health should be measured by how well we protect and sustain human life, not by how efficiently we eliminate it. Abortion ends the lives of hundreds of thousands of unborn children each year, which is itself a public health tragedy. While some claim it reduces maternal mortality or poverty, those issues are better addressed by improving prenatal care, expanding healthcare access, and supporting families, not by destroying life. Studies also show abortion can have negative physical and psychological effects on women, including increased risk of depression and complications in future pregnancies. True public health solutions strengthen both mothers and children, offering resources, medical care, and community support. A society that equates health with access to abortion overlooks the dignity of the most vulnerable and misses the chance to promote life-affirming alternatives that benefit everyone.
Yes, abortion access significantly improves public health across multiple measurable outcomes. Maternal mortality decreases when women can access safe, legal procedures and comprehensive reproductive health care. Countries and states with abortion access have lower maternal death rates. Family planning improves when people can time pregnancies appropriately, leading to healthier spacing between births, reduced high-risk pregnancies, and better prenatal care for wanted pregnancies. Economic health benefits include reduced poverty rates, increased educational attainment, and better child welfare outcomes when families can plan their size and timing. Healthcare infrastructure strengthens when reproductive health providers can offer comprehensive services including contraception, STI testing, cancer screenings, and prenatal care, services that benefit entire communities. Population health improves when unwanted pregnancies are reduced through comprehensive reproductive health care, leading to better outcomes for existing children and families. Mental health benefits when people aren't forced into unwanted pregnancies, reducing depression, anxiety, and domestic violence rates. Public health data consistently shows that societies with comprehensive reproductive health care have better overall health outcomes across all demographics.
Should abortion be considered part of essential health care?
No, abortion should not be considered part of essential health care, because healthcare's purpose is to heal, preserve, and protect life, not to intentionally end it. Labeling abortion as essential redefines medicine in a way that undermines its most basic ethical foundation. First, do no harm. The unborn child is a distinct human being, and ending that life is not a medical treatment, but the destruction of a patient. Essential healthcare includes prenatal care, safe delivery, maternal support, and interventions in emergencies where both mother and child are treated with dignity. Framing abortion as essential sidesteps real solutions, better healthcare access, financial assistance, adoption support, and policies that empower women to thrive without sacrificing their child. True essential healthcare uplifts both mother and child, ensuring that medicine remains focused on preserving life rather than terminating it. Yes, abortion should absolutely be considered essential healthcare. Major medical organizations worldwide recognize it as such. Medical consensus is clear. The WHO, American College of Obstetricians and Gynecologists, American Medical Association, and virtually every major medical body classify abortion as essential health care. It's oftentimes sensitive and medically necessary. Emergency situations require immediate access, ectopic pregnancies, severe fetal abnormalities incompatible with life, maternal health crises. Delays can be fatal or cause permanent damage. Reproductive health care integration means abortion is part of comprehensive women's health services alongside contraception, prenatal care, and miscarriage management. Separating it creates artificial barriers that harm patient care. Healthcare equity requires consistent access. When abortion is treated as elective rather than essential, insurance coverage gaps and facility restrictions create unequal access based on wealth and geography. Evidence-based medicine supports abortion as safe, common health care. It's safer than childbirth and many routine procedures we consider standard care. Treating abortion as non-essential health care contradicts medical evidence and professional standards, politicizing what should be clinical decision-making.
How does access to abortion affect poverty and inequality?
Abortion is often promoted as a solution to poverty and inequality, but in reality, it addresses neither root cause. It only ends the life of the child. Suggesting abortion as the answer to economic hardship implies that the poor are better off if their children never live, which devalues both mother and child. True justice addresses poverty by expanding access to education, healthcare, housing, childcare, and job opportunities, not by eliminating lives that might otherwise struggle. In fact, communities already burdened by inequality are often targeted most heavily by abortion providers, deepening cycles of loss rather than lifting people out of hardship. Supporting women with resources, maternity care, and family assistance empowers them to choose life without being forced into an impossible economic dilemma. A society committed to equality should fight poverty itself, not eliminate the poor by promoting abortion.
Abortion access dramatically reduces poverty and inequality, the evidence is overwhelming. Economic mobility improves when people can control reproductive timing. Studies show women denied abortions are more likely to experience long-term poverty, while those who receive them are more likely to complete education and advance careers. Intergenerational poverty decreases when families can plan their size and timing. Children in planned families receive more resources, education, and opportunities. Educational attainment increases significantly with reproductive choice. The ability to delay childbearing allows completion of education and professional development, breaking cycles of economic disadvantage. Gender equality in employment and wages improves when women can participate fully in the workforce without forced interruptions. Healthcare costs decrease when people can access timely reproductive care rather than expensive emergency interventions or long-term support for unwanted pregnancies. Geographic inequality worsens with abortion bans. Wealthy women travel for care, while poor women are forced into motherhood regardless of circumstances. Studies consistently show that reproductive autonomy is one of the most effective anti-poverty interventions, allowing people to escape economic disadvantage through education and career advancement.
Does banning abortion disproportionately harm women of color and the poor?
Banning abortion does not inherently harm women of color or the poor. It protects their children, who are often the most targeted by the abortion industry. In fact, abortion providers like Planned Parenthood disproportionately place clinics in minority and low-income neighborhoods, leading to higher abortion rates among these communities. Framing abortion as a solution to poverty or systemic inequality treats vulnerable populations as though their lives and their children's lives are less worth protecting. The real injustice is failing to address the root causes: lack of healthcare access, financial support, childcare, and opportunities. A just society should ensure women of all backgrounds receive the resources they need to carry their pregnancies and raise their children with dignity. Banning abortion paired with strong social support doesn't harm women of color or the poor. It affirms their equal value and refuses to solve inequality by eliminating their children.
Yes, abortion bans create devastating disparities that disproportionately harm women of color and poor women. This is both predictable and documented. Economic barriers multiply under bans. Wealthy women can travel to other states or countries for safe procedures, while poor women cannot afford travel, lodging, childcare, or time off work. This creates a two-tiered system based on wealth. Geographic disadvantage compounds racial and economic inequality. Women of color are more likely to live in restrictive states and lack resources to travel, making them most vulnerable to dangerous illegal procedures. Healthcare access is already limited for marginalized communities. Clinic closures eliminate not just abortion access but contraception, STI testing, and routine care that these communities depend on. Historical precedent confirms this pattern. Pre-Roe, wealthy white women obtained safe illegal abortions, while poor women and women of color died from unsafe procedures. Maternal mortality rates are already highest among Black women. Forcing high-risk pregnancies worsens these deadly disparities. Criminal justice disparities mean women of color face harsher prosecution for pregnancy-related crimes. Bans don't eliminate abortion, they eliminate safe abortion for the most vulnerable.
Should society focus on preventing unwanted pregnancies instead of banning abortion?
Yes, society should work to prevent unwanted pregnancies, but that goal is not an alternative to banning abortion. It complements it. Prevention through education, access to health care, and support for responsible choices can reduce the number of women feeling pressured toward abortion. However, even with prevention, some pregnancies will still be unexpected. The key question remains: is it ever justifiable to end the life of an unborn child? If the answer is no, then prevention alone cannot replace the need for legal protection of the unborn. We don't excuse the killing of born children because prevention of hardship failed, and the same logic applies before birth. A just society should pursue both, reducing unplanned pregnancies through prevention and ensuring that when they occur, abortion is not the default option, but life-affirming support for mother and child is available.
Absolutely. Preventing unwanted pregnancies is far more effective than banning abortion and aligns with everyone's stated goals. Evidence-based prevention works. Comprehensive sex education, accessible contraception, and healthcare coverage reduce abortion rates by 50 to 70%. States with the best prevention programs have the lowest abortion rates, regardless of legal restrictions. Common ground exists here. Both pro-choice and anti-abortion advocates want fewer unwanted pregnancies. Prevention strategies achieve this without the coercion, health risks, and constitutional violations of bans. Comprehensive support includes affordable childcare, paid family leave, healthcare coverage, and economic support that make parenthood more feasible for those who want it. Public health success stories like Colorado's free IUD program show dramatic reductions in unintended pregnancy and abortion rates when barriers to contraception are removed. Cost-effectiveness is clear. Prevention programs save taxpayers money compared to the costs of unwanted pregnancies, poverty programs, and enforcement of abortion bans. Real results require addressing root causes rather than criminalizing outcomes. Societies focused on prevention achieve lower abortion rates while protecting individual freedom and health.
Does abortion devalue human life?
Yes, abortion devalues human life by suggesting that a person's worth depends on circumstances like age, size, health, or whether they are wanted. When society allows unborn children to be ended because they are inconvenient, disabled, or conceived in hardship, it sends the message that some lives are expendable. This mindset can ripple outward, shaping how we treat the elderly, the disabled, and others who rely on care. History shows that when certain groups are deemed less human, injustice follows. By contrast, affirming the equal dignity of every human being from conception onward upholds a culture of life where no one's value is negotiable. Abortion not only ends individual lives, it weakens society's commitment to protecting all vulnerable people. To truly honor human dignity, we must recognize that every life, no matter how small or dependent, has intrinsic and equal value.
Abortion access actually affirms the value of human life by ensuring children are wanted, planned, and can be properly cared for. Valuing existing life means protecting pregnant people's health, autonomy, and life plans. Forcing unwanted pregnancies devalues the lives, dreams, and well-being of actual people with established relationships and responsibilities. Quality over quantity matters. Societies that support reproductive choice tend to have better child welfare outcomes. When families can plan pregnancies, children receive more resources, attention, and care. Comprehensive life valuing includes robust healthcare, education, social support, and economic opportunity. Many who claim to value life oppose these supportive policies, revealing inconsistent priorities. Medical reality shows that many pregnancies naturally end in miscarriage due to genetic abnormalities. Abortion sometimes prevents prolonged suffering when severe fetal conditions are diagnosed. Life circumstances matter. Forcing pregnancy in cases of rape, incest, poverty, or health risks doesn't honor life, it perpetuates suffering. True respect for human life means trusting people to make thoughtful decisions about when they can provide good lives for children, supported by comprehensive social systems that value all human flourishing.
How does abortion affect gender equality in society?
Abortion is often framed as essential to gender equality, but in reality, it undermines it. True equality means valuing women not for their ability to function like men, but for their inherent dignity, including their unique capacity to bear children. Abortion suggests that to be equal, women must deny or eliminate this natural role, effectively pitting them against their own biology. It also enables systems that fail to support mothers' employers, schools, and governments to avoid real reforms by offering abortion as the solution. Moreover, abortion often pressures women into choices they don't truly want, serving male convenience or economic pressures rather than genuine empowerment. Real gender equality affirms women as whole persons, providing support so they can flourish as mothers and participants in society. Equality should not come at the expense of their children's lives, but through structures that honor both women and the lives they create.
Abortion access is fundamental to gender equality. Reproductive control directly determines women's ability to participate equally in society. Economic equality requires reproductive autonomy. Without abortion access, women face forced career interruptions, educational delays, and economic disadvantage that men never experience. This creates systematic inequality based purely on biology. Political participation suffers when women can't control reproductive timing. Leadership roles, elected positions, and civic engagement become harder when pregnancy can derail plans against one's will. Educational achievement gaps widen with abortion restrictions. The ability to delay childbearing until after education completion is crucial for women's advancement in higher education and professional fields. Workplace equality becomes impossible when employers can assume women might be forced into unplanned pregnancies, affecting hiring and promotion decisions. Historical evidence shows that reproductive rights directly correlate with women's advancement. Countries and eras with greater reproductive freedom show better gender equality outcomes. Constitutional equality requires equal opportunity to pursue life, liberty, and happiness, impossible when one sex can be forced into parenthood while the other cannot be. Reproductive autonomy is the foundation upon which all other gender equality rests.
Should abortion be allowed in cases of rape or incest?
Rape and incest are horrific crimes, and women who endure them deserve profound compassion, justice, and support. But the question is whether abortion is a just response to such violence. Abortion does not erase the trauma of rape, it adds another, by ending the life of an innocent child. The child did not commit the crime and should not be punished for the father's sin. Instead, justice should be directed at the perpetrator, while society surrounds the mother with care, counseling, and resources. Many survivors who carry to term testify that choosing life helped them reclaim dignity and hope. While these situations are extraordinarily difficult, the principle remains: to wrongs do not make a right. Protecting both mother and child affirms that even in the worst circumstances, every human life retains dignity and worth.
Absolutely. Denying abortion in rape and incest cases compounds horrific trauma with further violation and cruelty. Forced pregnancy from rape means the state is forcing victims to carry their attacker's child for 9 months, enduring constant physical reminder of their trauma. This is a profound second victimization that can destroy psychological recovery. Incest cases often involve children. Forcing a 12-year-old rape victim to give birth is unconscionable. These pregnancies carry extreme health risks and psychological devastation for developing bodies and minds. Trauma recovery becomes nearly impossible when victims are forced to remain physically connected to their assault through pregnancy. Mental health professionals recognize this as deeply harmful to healing. Practical realities matter. Rape prosecutions take years, making legal exceptions with court requirements meaningless. Victims shouldn't need to prove their trauma in court to access healthcare. Moral consistency is crucial. If abortion is sometimes acceptable as most Americans believe in rape cases, then the principle of bodily autonomy and reproductive choice is already established. Even those who generally oppose abortion often support exceptions for rape and incest, recognizing the unique cruelty of forced pregnancy in these circumstances.
Should abortion be legal if severe fetal abnormalities are diagnosed?
No, abortion should not be legal solely because severe fetal abnormalities are diagnosed. Every human life has intrinsic worth, regardless of ability, health, or prognosis. To permit abortion in such cases suggests that some lives are less valuable or not worth living, a dangerous and discriminatory mindset that undermines the dignity of the disabled. Many diagnoses are uncertain or less dire than predicted, and countless children with disabilities enrich their families and communities in profound ways. Even when a condition is truly life-limiting, the compassionate response is perinatal hospice and support for the family, not ending the child's life prematurely. Abortion in these cases shifts focus from care to elimination. A just society does not measure human worth by perfection, but by inherent dignity. Therefore, instead of abortion, we should offer love, medical care, and support to families facing these heartbreaking situations.
Yes, abortion should be legal for severe fetal abnormalities. Denying this option forces families into unimaginable suffering. Medical reality includes conditions incompatible with life outside the womb, anencephaly, severe neural tube defects, genetic disorders causing immediate death or profound suffering. Forcing continuation serves no purpose except prolonging agony. Family compassion means trusting parents to make heartbreaking decisions about their wanted pregnancies. These are often desperately wanted babies whose parents face impossible choices between prolonged suffering and merciful endings. Quality of life matters. Some conditions guarantee only pain, inability to interact, or survival measured in hours or days. Forcing birth in these cases can cause immense suffering for both child and family. Healthcare expertise is crucial. Doctors can provide detailed information about prognosis, suffering levels, and realistic outcomes that parents need for informed decisions. Grief and healing processes are disrupted when families can't make compassionate choices about terminal diagnoses. This compounds trauma and prevents healthy grieving. Resource allocation should focus on supporting families through difficult decisions rather than forcing predetermined outcomes regardless of circumstances. Compassionate healthcare trusts families with these profound moral decisions.
What about pregnancies that threaten the mother's life?
When a pregnancy truly threatens the mother's life, doctors may need to act to save her, but this is different from directly and intentionally aborting the child. Medical interventions, such as treating ectopic pregnancies or inducing early delivery in severe cases of preeclampsia, aim to preserve the mother's life while giving the child every possible chance of survival. Sadly, the baby may not always live, but the intent is never to deliberately kill. Pro-life ethics recognize the principle of double effect. When a treatment to save the mother unintentionally results in the loss of the child, it is morally distinct from abortion. Laws restricting abortion typically allow such life-saving care. The goal should always be to protect both patients to the fullest extent possible. In short, protecting the mother's life does not require legalized abortion, it requires compassionate, ethical medicine that values both lives.
Life-threatening pregnancies absolutely require abortion access. This should be uncontroversial, yet current laws are creating deadly delays. Medical emergencies like severe preeclampsia, placental abruption, sepsis, and cardiac complications can kill within hours. Doctors need immediate authority to save lives without legal consultation. Current reality is horrifying. Women are dying in states with restrictions while doctors fear prosecution. Kate Cox in Texas, forced to flee her state despite a dying fetus threatening her life. Women bleeding in parking lots while hospitals consult lawyers instead of providing care. Ectopic pregnancies are never viable and always fatal without treatment, yet some restrictive laws create confusion about whether treating them is legal abortion. Medical judgment cannot be second-guessed by politicians or prosecutors. Split-second decisions based on rapidly changing conditions require professional expertise, not legal committees. Maternal mortality has already increased in restrictive states, with preventable deaths from delayed care. Basic ethics recognizes that preserving existing life takes priority when pregnancy threatens maternal survival. When abortion bans interfere with life-saving medical care, they become a death sentence for pregnant people.
Should minors need parental consent for abortion?
Yes, minors should need parental consent for abortion, just as they do for far less serious medical decisions like surgery, tattoos, or even certain medications. Parents are responsible for their children's well-being and are best positioned to provide guidance, protection, and support in such a life-altering situation. Allowing a minor to undergo an abortion without parental involvement undermines family rights and exposes vulnerable girls to coercion or abuse, often hiding the crimes of older perpetrators. Moreover, abortion has significant physical and emotional risks, and a minor should not face them alone. While exceptions may be needed in cases of abusive households, the general principle stands: parents have both the duty and the right to be involved in decisions of this magnitude. Requiring consent affirms family responsibility and ensures that vulnerable minors are not left to navigate abortion's consequences without support.
Parental consent requirements, while well-intentioned, can endanger vulnerable minors and should include robust alternatives. Ideal families involve supportive parents helping teens through difficult decisions. Most minors do involve parents voluntarily, but mandating consent ignores dangerous realities many teens face. Abuse situations make consent requirements deadly. When pregnancy results from family sexual abuse or when disclosure would trigger violence, these teens need protection, not forced exposure to their abusers. Family rejection can lead to homelessness, violence, or being kicked out when conservative families discover pregnancy. Some teens face honor violence or forced marriage. Judicial bypass options are crucial, but often inadequate. Requiring scared teens to navigate court systems creates barriers and delays in time-sensitive situations. Alternative adult involvement: grandparents, counselors, clergy provide support while protecting vulnerable teens from family violence. Medical exceptions should exist when involving parents would harm the minor's well-being or safety. Comprehensive support, including counseling, ensures teens receive guidance without endangering those in abusive situations. The goal should be supporting teens while protecting the most vulnerable from additional harm.
Is there a morally acceptable middle ground between pro-life and pro-choice?
A true middle ground is difficult because the core question is whether the unborn is a human being with a right to life. If the answer is yes, then abortion is the intentional killing of an innocent child, and no compromise can justify that. If the answer is no, then abortion is simply a medical choice, and restricting it seems unjust. Some propose limits allowing abortion in early stages or in rare circumstances, but but these lines are ultimately arbitrary, valuing some lives while denying others. The moral principle of human equality means every life, regardless of age or condition, deserves protection. That said, common ground can be found in reducing unplanned pregnancies, supporting mothers, expanding adoption, and providing compassionate care for women in crisis. But on the central moral issue whether it is right to intentionally end unborn human life, there is no middle ground that avoids injustice.
Many people seek middle ground through gestational limits with exceptions, but this still fundamentally upholds pro-choice principles that reproductive decisions belong to individuals, not government. Common positions include legal abortion early in pregnancy with exceptions for rape, incest, fetal abnormalities, and maternal health throughout. This reflects most Americans' views and many European policies. Practical consensus exists around prevention, comprehensive sex education, accessible contraception, healthcare coverage, and family support. Both sides want fewer unwanted pregnancies. However, the core philosophical divide remains: who decides? Pro-choice advocates believe individuals should make these decisions with medical guidance. Restrictions still impose external moral judgments on personal healthcare decisions. Real-world implementation of middle ground policies often creates the same problems as bans, delays in care, geographic disparities, and dangerous exceptions that risk maternal health. Constitutional principles of bodily autonomy and medical privacy don't admit easy compromise. Either individuals have reproductive autonomy or government controls intimate decisions. The most productive middle ground may be ensuring robust support for whatever decision people make, rather than restricting choices.
Will abortion rights expand or contract in the coming decades?
Abortion rights in the U.S. are likely to contract over the coming decades more than they expand. Below are some trends and reasons supporting that view. You can tell me if you'd like counter-arguments after. State-level bans and restrictions are increasing. Many states have enacted strict abortion bans or limits. Even in states where citizens have passed constitutional amendments to protect abortion rights, many of the restrictive laws remain pending court challenges. Public opinion is mixed and divided, increasingly polarized by geography. Polling shows that Americans' views vary strongly depending on what state they live in. States with restrictions see more people saying abortion should be harder to obtain. In more liberal states, opinions are more pro-access. Voters in several states recently did vote to protect abortion rights, which is a counter-trend. But these wins are localized. Technology and abortion pills, telehealth increase pressure. As medication abortion by telehealth and via mail becomes more common, it provides ways around state bans, or at least strains enforcement. Legal disputes over these alternatives are already underway, suggesting more battles rather than clean expansion. Why contraction more likely? Momentum among pro-life lawmakers. Many state legislatures, especially in more conservative states, are already pushing further restrictions. Once a state has a ban or strong limits, it's easier politically and legally to tighten rather than loosen. Judicial and legislative pressure. Courts and legislatures may continue to uphold or even strengthen restrictions. Decentralization of law post-ops. With Roe v. Wade overturned, there's no federal protection ensuring abortion access everywhere. States are the battleground. Where politics lean pro-life, laws will likely reflect that. Cultural and social pressure. If social norms shift e.g., more support for life-affirming options, support networks for pregnant women, more visibility of prenatal care, there may be less public appetite for expansive abortion. Possible countervailing forces. Still, some forces could push for expansion or stabilization, stronger federal protections, or laws passed by Congress, though politically challenging. More states passing constitutional amendments protecting abortion rights via ballot initiatives. Challenges in enforcement of bans, especially with technology, interstate conflicts, shield laws. Changing public opinion, especially among younger generations, could shift over time. Given the current legal, political, and cultural landscape, and the fact that abortion law is now mostly determined at the state level, the likely scenario is that abortion rights will contract in many parts of the country in the decades ahead, and that access will remain highly variable. If you want, I can also lay out what would need to happen for abortion rights to expand, and weigh which path seems more plausible.
Abortion rights will likely expand over the coming decades, driven by demographic, political, and practical realities. Public opinion consistently shows majority support for abortion access, especially among younger generations. Gen Z and millennials are significantly more pro-choice than older cohorts, and this generational shift is accelerating. Political backlash to Dobbs has been swift and decisive. Post-Roe elections show voters consistently reject abortion bans, even in conservative states like Kansas, Kentucky, and Montana. Republican politicians are already moderating positions due to electoral losses. State-level progress continues with ballot initiatives, legislative action, and constitutional amendments protecting reproductive rights. Blue states are strengthening protections and becoming sanctuary states. Medical technology makes early abortion increasingly accessible through telemedicine and medication abortion, making restrictions harder to enforce practically. Economic reality shows the costs of forced pregnancy, healthcare, social services, lost productivity, creating pressure for policy change. International trends show global movement toward liberalization, with countries like Ireland, Argentina, and Colombia expanding access. Federal restoration becomes likely as demographics shift and political costs of restrictions become clear. The post-Dobbs backlash suggests rights will ultimately expand beyond pre-2022 levels.
Can technology like artificial wombs solve the abortion debate?
Technology like artificial wombs may change how we view pregnancy, but it cannot fully solve the abortion debate. If the core issue is whether the unborn child has a right to life, then technology that allows survival outside the mother only reinforces that dignity. It doesn't erase the moral question. Even with artificial wombs, some may still argue for a right to end life rather than transfer it, showing that the dispute isn't only about dependence, but about the value we place on the unborn. Moreover, access to such technology would likely be limited and unequal, leaving many situations unchanged. While advances could offer alternatives that reduce conflict by allowing women to avoid carrying while preserving the child's life, they don't remove the fundamental moral principle. Every human being, regardless of stage or circumstance, has an inherent right to live. Technology can help, but it cannot replace moral clarity.
Artificial wombs won't solve the abortion debate because the core issue isn't just fetal survival, it's bodily autonomy and reproductive control. Hypothetical technology might theoretically allow fetal transfer instead of termination, but this doesn't address fundamental concerns. Pregnancy involves more than just fetal development. It's about when and whether someone becomes a parent. Parental obligations would still arise. Even with artificial wombs, the genetic parents might face legal, financial, or emotional responsibilities for resulting children. This doesn't resolve the autonomy question. Medical realities matter. Fetal transfer would still require invasive procedures, health risks, and recovery time. It's not equivalent to taking a pill or minor outpatient procedure. Economic implications are staggering. Who pays for artificial gestation? Who cares for the resulting children? This could create massive social burdens. Choice remains central. People seek abortion, not just to avoid pregnancy's physical aspects, but to control if and when they become parents. Technology doesn't change the fundamental right to reproductive self-determination. The debate will persist because it's ultimately about who controls reproductive decisions, not just fetal survival.
Should abortion decisions be left to individuals, doctors, or the state?
Abortion decisions cannot be left solely to individuals or doctors because they involve more than one life. The unborn child is a distinct human being, and the state has a duty to protect innocent life, just as it does for born children. While individuals and doctors play important roles in healthcare, no one has the moral or legal authority to decide whether another person lives or dies based on convenience, health, or circumstance. If the unborn is human and science affirms this, then abortion is not just a private medical choice, but a matter of justice. The state's role is not to control women's bodies, but to safeguard the rights of all its citizens, especially the most vulnerable, who cannot speak for themselves. Therefore, abortion must be addressed through laws that protect life, while also ensuring compassionate support for women facing crisis pregnancies.
Abortion decisions should be made by individuals in consultation with their doctors, not dictated by the state. Individual autonomy is fundamental. The person experiencing pregnancy bears all physical, emotional, and economic consequences. They're best positioned to weigh their health, circumstances, family situation, and values. No one else lives with these consequences. Medical expertise is essential for safe, informed decisions, Doctors provide crucial information about health risks, fetal development, treatment options, and individual medical factors that politicians cannot understand from legislative chambers. State interference represents dangerous government overreach into intimate personal decisions. Politicians lack medical training, don't know individual circumstances, and shouldn't control private healthcare choices. This creates precedent for government control over other medical decisions. Collaborative decision-making between patients and doctors ensures informed consent, medical safety, and respect for individual values. This model works for all other healthcare decisions. Constitutional principles of privacy, liberty, and bodily autonomy support individual choice with medical guidance, not state mandates. The state's role should be ensuring safe, accessible healthcare, not making intimate medical decisions for people.
Is abortion a tragedy, a right, or both?
Abortion is a tragedy, not a right. It is a tragedy because it ends the life of an innocent child and often leaves lasting wounds on the mother, father, and family. Calling it a right transforms something destructive into something to be celebrated or protected, which distorts the very idea of human rights. True rights safeguard life, liberty, and dignity. They do not authorize the taking of life. Many women who choose abortion do so under pressure, fear, or lack of support, which makes the situation even more heartbreaking. Society should respond with compassion, not by enshrining abortion as a freedom, but by addressing the circumstances that drive women to feel they have no choice. Abortion is not empowerment, it is the loss of two, the child's life and the mother's peace. Therefore, abortion is best understood as a human tragedy, never a genuine right.
Abortion can be both a tragedy and a right. These aren't contradictory positions. Personal tragedy exists in many cases. Wanted pregnancies ended due to fatal abnormalities, health crises forcing impossible choices, or circumstances that make parenthood devastating. The emotional pain is real and shouldn't be minimized. Societal tragedy lies in the conditions that make abortion necessary: lack of support for families, inadequate healthcare, poverty, violence, or educational barriers. These represent failures we should address. Fundamental right exists simultaneously: the right to make intimate decisions about your body, health, and future. Rights don't cease to exist because exercising them is difficult or painful. Complex emotions are normal. Someone can support abortion rights while personally finding the decision heartbreaking. Many who have abortions describe mixed feelings, relief combined with sadness. Policy implications matter. Recognizing tragedy should inspire comprehensive support systems, better prevention, and compassionate care. It shouldn't justify removing rights or adding barriers. Respecting both aspects means supporting people through difficult decisions while working to reduce the circumstances that make abortion feel necessary, not eliminating the option when it's needed.
Which vision, pro-life or pro-choice, leads to a more just society?
The pro-life vision leads to a more just society because justice begins with protecting the most vulnerable. A society that denies the unborn the right to life creates a hierarchy of human value, where some lives are expendable based on age, dependence, or wantedness. That erodes the very foundation of equality. By contrast, the pro-life vision affirms that every human being, regardless of stage of development or circumstance, deserves dignity, protection, and care. This vision also calls society to support mothers, fathers, and families with compassion, ensuring that no woman feels forced to choose between her child and her future. True justice is not about maximizing individual autonomy at the expense of others, but about recognizing and safeguarding the inherent rights of all. A pro-life society is one where both mother and child are valued, where life is defended consistently, and where equality is rooted in the uncheckable truth that every human life matters.
The pro-choice vision creates a more just society by upholding fundamental principles of equality, freedom, and human dignity. Individual justice requires trusting people to make intimate decisions about their own bodies and futures. Justice means respecting human agency, not imposing uniform outcomes regardless of circumstances. Gender justice demands reproductive equality. When one sex can be forced into parenthood while the other cannot, we create systematic inequality that undermines women's full participation in society. Economic justice improves when people can control reproductive timing, escape poverty through education, and plan families they can support. Forced pregnancy perpetuates cycles of disadvantage. Healthcare justice requires medical decisions between patients and doctors, not political interference in private healthcare. Evidence-based medicine serves justice better than ideological mandates. Constitutional justice protects minority rights from majoritarian tyranny. A just society doesn't force religious or moral beliefs on everyone through law. Compassionate justice recognizes life's complexity. Rape, incest, fatal abnormalities, health crises require individualized responses, not blanket prohibitions. True justice supports comprehensive systems that value both reproductive choice and robust support for families, allowing people to thrive regardless of their decisions.